Welcome back. Today we are highlighting Antibiotic Awareness Week, and this is a vital part of medicine. So we have two people here to talk about the importance of this, Rachel Foster and Chris Whitman, both with Infirmary Health. Thank you guys for stopping by. I want to start with the basic first, right? Let's talk about that antimicrobial stewardship and why it's important for public health.
Yeah, so antibiotics are life-saving drugs. They're one of the best tools that we have in medicine, but they're only as good as they are now. So if we use them incorrectly, they can lose their effectiveness. So antimicrobial stewardship at its basics is just using using antibiotics appropriately. Our goal is to make them last as long as possible today, tomorrow, and for the future generations.
I remember once upon a time hearing about, antibiotic resistance and that how it can easily develop when you're overusing them. Is that still such a thing?
Yeah, that's exactly right. And that's why programs like ours exist. So when we say antibiotic resistance, we're referring to when bacteria are no longer killed by the antibiotics that we would typically use to treat them. And so that can happen naturally, but it can also happen more quickly and more often when you're using antibiotics broadly in the community. And so the fear is over time, the more exposure that our bacteria have, the more likely they are to become resistant and create these infections that are a lot more difficult to treat.
Okay, I want to dive deeper into that because a lot of people believe that there is a resistance that can develop. There's some truth to that, or is that a misconception?
Yes, it is very much a real thing that's happening today. And so our goal is to encourage the smart use of antibiotics and the appropriate use and not overusing them so that, we know this is already happening. It's here, but we want to slow it and prevent it as much as we can. And
you talked about this just in your answer the first time, how these medicines, they're available to be used and they need to be used the right way.
Yep, and that's one of the biggest misconceptions, even with flu season, about antibiotics do not work for viruses. So the flu, RSV, most sore throats, antibiotics are not active. So not only are they not working to treat the virus, but they're also causing harm, increasing resistance and side effects.
Yeah. So what can people do? I mean, because the first thing you want when you're not feeling well is to feel better. So in addition to coming in, to being seen, what should you do?
Yeah, there's really an important role that we all play, and having an awareness of this is very important. So I think first recognizing that not all bacteria are bad and not all infections need antibiotics. A lot of them actually will self-resolve on their own with time and supportive care. Also preventing these infections to begin with, keeping in mind good hand hygiene practices, washing your hands throughout the day, staying up to date on your vaccines, because a lot of these are vaccine preventable as well. Not saving antibiotics or sharing them. Each time you have a new infection, it really needs to be reassessed to make sure you're getting the right thing for that specific scenario. And we also encourage patients to ask questions. Whenever you are potentially getting prescribed an antibiotic, make sure you have a good understanding and have a conversation about what exactly it's being used for and how it's supposed to benefit you, and also what side effects to look out for.
Those are very good reminders there. I've got one more question because you mentioned making sure that you finish your medicine when it's given to you. Is there a difference between bacteria and viral, like when antibiotics are prescribed?
Yes, absolutely.
Yes, completely.
Okay.
Antibiotics do not work on viruses at all there. And again, they're just potentially causing more, these antibiotics, they can cause harm as well. So if you're not using them appropriately, as well as just increasing that resistance. So when you do have a true infection and need the antibiotics, they're much more likely that they won't be effective and active.
Okay, well, thank you guys for stopping.